Ali, thank you for joining me. How are you doing?
Thank you for having me, Galina. I'm doing good. How are you doing?
I'm doing really well. I'm so excited to talk to you because you have just a wealth of knowledge in things that I thought I was educated about, but I'm going to learn today where I'm at.
I think you know more than you think you do.
Tell me a little bit about, tell my listeners about what you do for a living.
So I am a therapist. I'm an LMFT and LPCC, and I primarily specialize in working with individuals with OCD, anxiety, and trauma. So I use ACT, which is acceptance and commitment therapy, which is what my workbook is about. It's just basically an integrative ACT workbook to really apply not only in session, but also for my clients to use outside of sessions. And also just for people who are looking to adopt these skills. Because as I was learning ACT, I found that it was like very applicable to my life. So my hope was that people can kind of just buy this and then implement the skills for themselves. And it can be really helpful adjunctively to therapy.
I've never heard of ACT before, and I'm guessing some of my listeners haven't either. Is this a relatively new therapy?
Yes, it is. It's one of the, I mean, it's been around for, a couple of decades, but it's relatively new and becoming more and more popular. It's part of the third wave behavioral therapies. So more commonly, people talk about CBT, cognitive behavioral therapy, or DBT, dialectic behavior therapy. So ACT is part of this like third wave behavioral therapies. And it's really more about rather than trying to like change cognitions or change emotions, it's really about accepting what shows up because in my experience, I can't get rid of my thoughts, I can't get rid of my feelings, and trying to do so only makes me feel worse. So this kind of therapy is really changing our relationship with our internal experiences so that we can still live our valued life.
I love that. And so, ACT therapy, if I were to go in for a session, explain what would happen to me like I'm a third grader.
Awesome. So I find every therapist, of course, has their own approach, but for people coming to see me, the first session is really just me asking, why is your life not what you want it to be? Like, what are the areas that you feel like are lacking? So some people say, I feel lonely, I want more social connection. Some people come in with a diagnosis that they know that they want to work on. And it's really more behavior based. So as opposed to the like old school therapy of Freudian of like, and how does that make you feel and going into your whole history, it's really more present moment awareness focused and future focused of what kind of person do you want to be and how do I help you to get to that goal.
What is like a typical first step in ACT?
So my first step always is starting off with values because that's what's going to direct the therapy for me largely is knowing what kind of person you want to be. So I have a values list in my workbook that I always give my clients in our first session and I have them just go through and identify what are their core internal values that really embody the person that they want to be. All of us value connection. We all want to have, even for us introverts, we all still want to have a couple of people that understand us and get us. And then there's other values like creativity, honesty, authenticity, spirituality for those, and it just really helps shape the therapy moving forward because once I know what's important to you, then we can derive actions out of those values that are in line with the values to get you to being the person that you want to be.
I love that. That sounds really proactive as far as treatments go.
Yes, and it's much more, it's quick change. I mean, as a therapist, it's so satisfying for me to do this kind of work because you're able to make changes in the here and now. And so each session my clients come back and they're like, "Oh, I did this that I wasn't doing before, or did this and it felt really good." And you can see these changes really fast rather than like digging into history and healing old wounds, which I do still do a little bit of, but really more just present and future focused.
I've heard of cognitive behavioral therapy, and that's something that I've explored. How is ACT different?
So I find that with CBT, there's all those distortions, those cognitive distortions that you learn with CBT, like filtering, catastrophizing, things like that. So rather than labeling thoughts and categorizing them as to why they're problematic, ACT just has a simple breakdown of is this a helpful thought or is this an unhelpful thought? So for my clients that have done CBT before and didn't find a lot of benefit from it, the main thing that they say that they value within ACT is, rather than labeling my thoughts and having another reason to shame and blame myself for doing something wrong, I'm into this framework of like, oh, this is either helpful or unhelpful. And then practicing just acceptance around all of our thoughts rather than trying to categorize and sift through them.
I love that. That does sound super helpful. How did you get into this?
So I actually started at a treatment center as assistant to the CEO. And during COVID, I was a non essential employee, so I got put on furlough. And in order to bring me back and make me an essential employee, they had me start doing exposure and response prevention within our anxiety and OCD clinic. So at that time, the director of that program had started implementing an ACT model and transitioning us away from CBT as a way to not only capture those people that CBT isn't really working for, but also differentiate ourselves as a program. So once I started working in that department, he trained me, he taught me everything I know. We did 2 supervisions a week where I would just dive in and learn more and more about ACT. And the more I learned and the more I worked within that department, the more I realized I had found like my perfect fit as a therapist, because I'm not the sit back kind of therapist. I'm very directive. I give advice when it's asked for. So it just fit my model and what I wanted to be doing so much better.
What kind of clients is that type of therapy good for?
Honestly, it can help anyone. It's not geared towards any specific diagnosis. It's been shown in research to help with anxiety, with depression, with OCD, with trauma. I use it with a client with dissociative identity disorder that it's been really helpful for, to kind of create a stable core within the values. It really can be applied to anyone.
Here's a question that you'll have a perspective on with your career.
Sure.
Do you think everybody should be in therapy?
Yes.
So quick. Can you expand
100%.
on that?
I don't think, I mean, granted, I was going to say therapy can't hurt, but there are bad therapists out there, of course. I do think finding a good therapist, all of us have room to grow, even if we did have, I had a very idyllic childhood. I had a pony, things were great. My parents were very there for me, very supportive. And even then, I still go to therapy because there's still things that I missed or I didn't learn as a child that I can strengthen. So I do somatic therapy for myself to really get into my body and be able to drop in and notice experiences. I think everyone can benefit from therapy. It's really helpful and it can really increase self development, self awareness. And I don't ever see that being a bad thing.
What do you say to people who think that they don't need it?
I always say, does everyone need it? No, I think you can probably live a pretty good life without therapy, and it'll go okay. And I think if you're a person like me that's curious about yourself and about the world, and you want to grow as a person, why not do it?
I love that. That's a good answer because I feel like I come across a lot of people, and for the most part, I think within my bubble and within LA specifically, people are really willing to work on themselves, and therapy has been normalized, which I'm excited about. But
Yes.
like with my family and with some of the culture in the Midwest that I come from too, it's still a little bit stigmatized. So I wonder if you can like shed some light on, especially with men, because I feel like they're a little more reluctant to go to therapy, of what it really means to just talk through things with a professional.
Yeah. It's so unfortunate because, I'm from the Midwest too. I do think there's still in a lot of places that stigma around therapy, that the only reason to go to therapy is if there's something wrong with you that needs to be fixed. And at large, I take problem with that idea of like fixing ourselves, fixing other people. We all want to grow in this life and be the best person that we can be. It's not the idea that like I'm broken and I need fixing and that's why I go to therapy. It's really about getting someone who can understand, who can provide a different viewpoint on things to open up your perspectives. and really explore like your life and how things have impacted you. It's really not about a broke fix kind of mentality. It's not like when you take your car to the mechanic, and it just sucks coming up against that stigma because it really is still out there. And for the people that dig their heels in, I have a hard time, even as a therapist, kind of getting them to see my side of things, of how this could be helpful and why it would be a valuable way to spend their time and money.
Absolutely. Do you think that it's ever too late for therapy? Are there people that are too far gone?
No. Okay. I don't think it's ever too late for therapy, in that I think that, I have clients from 17 to in their 80s. So I don't think it's ever too late for therapy from an age perspective. I do think there's certain people that won't get much out of therapy, like you hear all the time these days about like narcissistic personality disorder. That's become like a real hot button topic, for all of us dating men out there who typically fall into this category. um, and I think for people that do have that type of diagnosis, usually people who have that diagnosis, we're looking at a history of trauma, and it's manifested as this narcissism. And for those people, sometimes therapy is not going to be super helpful, because you have to be able to acknowledge your own faults and weaknesses and take accountability in order to be able to grow. So people that typically have that diagnosis aren't able to do that. They're always deflecting accountability and responsibility and just putting it on everyone else. So I think in a case like that, you're not going to get much out of therapy. They're only going to get further validated in their viewpoints. But if someone can get to the point of saying, hey, I screwed up, I made a mistake, if you can just take accountability for your actions, therapy will benefit you.
That's the best way to put it, because I think even going to therapy, which granted, maybe it won't work for those people, but maybe those people won't even set foot in a therapist's office.
They
But
usually
it's
do.
that initial urge of like, I want to work on myself. I want to do something. And plus, like with narcissism, and I definitely want to touch on that because it is such like a pop psych term, and everyone that breaks up with somebody is like, they're a narcissist. It's all you hear these days.
Gaslit me.
How common is like actual true narcissism?
I mean, a true NPD diagnosis is not that common. I think people can exhibit the behaviors, but to meet a full-fledged narcissist that is all in on it, it's not everywhere. It's not as much as you're hearing about it. I think what we're hearing is more so people either misusing those terms and misgauging like the actions that their partner took. And then I think there's a lot of traits. I think we all have certain narcissistic traits, because if you look at things on more of a spectrum rather than a diagnosis, you don't want to have no ego whatsoever and no narcissistic traits, because there's no self-belief at that point. So it's really getting to just the right amount of narcissism, of like believing in yourself, but still having humility and being able to take accountability, instead of getting all the way to the other side of the spectrum of I'm amazing, I have no faults, and everyone else is just the problem.
Do you think it's more prevalent in men or women?
Men.
Oh, interesting.
Yes. Usually we will see NPD more in men. The other axis to, like formerly known as axis to, and personality disorders, sometimes we'll see more like borderline traits typically show up more in women than men. More histrionic kind of behaviors. But again, all these things are on a spectrum. I largely don't like to diagnose people with personality disorders because they're so stigmatizing. And usually when you Google them, the internet's like, you're stuck with this for life. There's no cure. We can always change, we can always grow, we can always break patterns. And I always like to highlight for clients that do have some of these behaviors that fall into these kinds of categories, that it does come from trauma. It didn't happen in a void. They had really tough childhoods and a lot of like attachment issues that bred this kind of pattern of behavior.
So in a perfect world, is narcissism curable?
In a perfect world, it would be everything.
Let's say with the right therapist, with the right amount of therapy, and with enough outside work, because I don't think you can do it in a vortex either, right? You have to do other stuff outside of therapy to work on it.
Yes. Yes. I think it is possible. It's all what someone is willing to do at the end of the day. So the narcissistic person, I do think there's therapists who specialize in this, who are qualified, who can help and make a difference. Um, but I always like to say, when we get into language around curing, there's no cure for the human condition. We're all going to experience, outside of narcissism, we're all going to experience difficult feelings in this life. It's really hard life and living and doing all the things. So we're all going to have these moments and times where difficult feelings come up. So it's really less about like curing and more about how do we manage and improve as much as possible.
That's a really good way of looking at it. It's a lot more manageable because you're right. I think about this with my healing journey in general, that I don't think I'm ever going to get to a point where I don't, and not to say I'm like reactive, because I'm definitely not, but as far as just anything that triggers me or anything that like catches a certain type of response from me, what I notice as I do work over the years is that I'm never going to stop the response from happening, but what's happening with my healing is I can come back to neutral faster.
Yes. Well, and I think that's the thing that I hear from people all the time is, I don't want to react to these things happening around me, or I don't want to have this response. And I use this term in ACT called dead man's goals, of like, you're essentially saying you don't want to have feelings. And that's a dead man's goal, because only dead people don't have feelings. If you're alive, if you're a living, breathing human, you're going to have feelings, you're going to have responses to things, and especially patterned responses that are a result of things that we've been through. We never get rid of those, but we can change our relationship to them and figure out how to ground more quickly afterwards, so that it's not overtaking us. It's just an experience that comes and goes.
That's so important. I'm going to highlight that and clip that and put it all over the world. That is like such an important way of saying that. Switching gears a little bit, but still kind of staying on the disorder end of it. So you work with a lot of OCD patients, is that right?
Yes, I do.
And because there's different, can you tell me about like the different categories of OCD?
Yeah, so there's a few different subtypes of OCD. There's a variety. Contamination is always the one that we see mostly in the media around like cleanliness or germs. There's obsessions around scrupulosity, which is always very interesting, around religion. There's morality OCD, which is this obsession of doing the right or the wrong thing and always having to do the right thing. We also have like perfectionism OCD, which I wouldn't be surprised if I fall into that category, as well as morality, really trying to hold yourself to a perfect standard, which as a human is impossible really at the end of the day. So it's this constant struggle. And then there's some more interesting ones that I think are not talked about as much, which is harm OCD, and then also pedophilic OCD, which are basically, and I do want to define OCD as I talk about these things, because I always get the response from people, which is that OCD is about intrusive thoughts. It's not about someone taking action in response to those thoughts. So people do have intrusive thoughts, and that's the obsession component. And then you have a compulsion that you do to neutralize the thought. So for individuals that have, the harm or the pedophilic OCD, they'll have an intrusive thought of, maybe they're holding a knife while they're cutting vegetables in the kitchen, and they think like, oh, I could stab my partner right now. Some of us enjoy that thought more than others, depending on how. But for those people that have OCD around this, the thought comes in, and then they think there's this process called thought action fusion, where they see the thought and the action as equal. So because they have the thought, they could actually do it. And it scares them so much that then they develop compulsory behaviors to neutralize the thought. So they by no means are a danger to anyone. If anything, they're less of a danger than the average person, because the thought scares them so much that a lot of these people that I work with in the treatment center have gotten to the point where they will lock themselves in their house rather than risk harming someone.
Can totally relate to that. And now I'm like, oh, I wonder if my stuff is at a diagnosable level or not, or if this is just totally normal. But I'll be driving on a bridge and go, what if I just turn the wheel?
What if I
What
just
if I just drive off this bridge right now? But I don't know, is that OCD or is that just everyone thinks that?
So my favorite line that my clinical director gives to our families is exactly that example. They actually did a study on people of how many people have the thought of, just driving off the road while they're driving on it. And 88% responded saying that they had had that thought, and the other 12% are lying. We all have those thoughts. The presence of the thought is not what makes it diagnosable as OCD. It's how you actually respond to the thought. So we all have weird, disturbing, gross, bizarre thoughts that come into our mind. But for most of us, we have that thought come in and we're like, well, not going to do that today. And we keep on trucking. Someone with OCD, the thought gets stuck. It's like a fly trap in your mind and you can't get it out, and it gets louder and says, you might do it, you might do it, you might do it. And it's so scary, and ego dystonic is what we call it. It's not pleasant to have, that it creates these compulsory behaviors. And then that's when we have a diagnosis of OCD.
What's something about OCD that you think the average person, even if they're struggling with it, doesn't know?
That they're not alone. I am shocked by how many times I have to tell people that phrase. Most of my clients, before they come to PCH, when they have these thoughts for the first time, a lot of them generate shame, especially for the POCD and the harm OCD. It's so shameful that they never talk about it. They just start reacting, and they think they're the only ones to have been through this. And if I could just put on a bullhorn to the world that we all have weird thoughts and that that's okay, I think it could change a lot of people's experiences, because there's so much shame and self-judgment around just having thoughts, as if we have control over them in the first place.
We don't.
We don't. We do not have control.
The most helpful thing I heard when I first started exploring meditation, because all of meditation is just on thoughts, right? It's all thought centered. It's how do I stop thinking? But you don't stop thinking. And the thing that was most helpful to me was picturing my thoughts as clouds of it. Just you just have to let the cloud pass, and you can look at it and be like, it's not permanent and it's not me. But that seems to be a lifelong journey that I'm on of remembering that I am not my thoughts.
Yes, and it applies to so many people. And I love that you bring up that example of using the clouds, because that is an act metaphor that we use of,
Oh,
watch your clouds as if, or sorry, watch your thoughts as if they're clouds passing by in the sky. ACT uses all of these metaphors because it's not just, acceptance is one of the main components, and then there's the behavioral action piece. But the other piece is there's a huge mindfulness component that comes with ACT. And one of the 6 core processes is present moment awareness. And then this idea of self as context, which is really getting in touch with what we call the observing self. So when we meditate, the goal is not to stop our thoughts and just have a quiet, silent mind, because that's borderline impossible. The concept is really more, can you get in touch with this observing self to just watch your thoughts and watch your feelings and watch your sensations and just observe them without judgment.
I love that. I want to get granular about it because you just said there's 6 components. Walk me through that.
So there's 6 core processes to ACT, all in the workbook to break it down. The first is acceptance, which is the idea of being willing to have our experiences. So stop fighting and trying to make them go away. The second component is called diffusion, which is the idea of creating space from our thoughts and feelings. And there's skills that we can implement to do that. Some of them are like, saying a thought in a silly voice, doing visualization techniques, picturing thoughts passing by, like on a cloud or on a leaf, or kicking it away with a soccer ball. Because the goal with diffusion is not to make it go away, but just to get enough space from it that our thoughts and feelings don't control our behaviors, that our values get to control them. And then by that, we move on to present moment awareness, which I just talked about, all in the name. Self is context, the idea of the observing self. And then there's values and committed actions. And committed actions are just the actions that we take in the service of our values.
I love that. Is OCD genetic?
So all the research that has been done, we don't know. Psychology is just a big guessing game. We do think there has been shown to be genetic components, also, modeling and learning from others, and then just environmental factors, genetic and environmental factors. It's really a combination of both. Um, there's no like cause of OCD. It really is just a matter of, how people respond to distress and how they cope. I have had a fair amount of clients who have had a traumatic incident and then they developed OCD in response to that. Because one of the things I'll say to my clients with OCD is that, when we're a kid or even as an adult, so much of our life is out of our control. And we don't have control over our internal experiences. We don't have control over the people around us. Terrible things happen. And OCD can pop up in those times because it's something that's like you can take action on. You have a distressing thought, and then there's a behavior to make it go away and make you feel better. And that idea of having that control can create structure within a world of chaos to make us feel like we have more control than we do, which I think is really interesting.
That is so fascinating. And then it kind of leads me to the question, and there's not going to be a direct answer to this because it's kind of like me asking if narcissism is curable. But with OCD, so if a person learns to control the compulsion portion of it, is that the cure to OCD?
Yes, essentially. Again, there's no cure. It's likely, I tell most of my clients, it's likely we're not going to get rid of these thoughts forever. And certainly in times of stress, we will see it spike back up. That even if we see a reduction in symptoms over time, if clients are going through really distressing times, we'll see OCD kind of starting to spike back up. So it's definitely not a cure situation. And if we can change how we respond to the thoughts, learn that they don't actually control our behaviors, learn that the compulsions are only buying us short-term relief, not long-term relief, and respond differently, we do see the thoughts kind of trickling down over time, and they have less power and less exertion over how we live our lives.
That's really hopeful. I like that.
Yeah, it's really nice to see with people. It's one of the reasons, with ACT, there's quick results. With OCD, you can really see some quick results because if you stop engaging in the compulsions pretty quickly, things start changing very fast. And as a therapist, it's so satisfying to just see people's lives change in a short time before you. It's like, oh, it's just so rewarding.
What is like the worst type of OCD?
If you asked each of my clients, all with different types of OCD, they would all say that theirs is the worst. We actually run an OCD group, and it's funny because there's times where I've run the group and everyone's sharing about what type of OCD they have, and they all say, I want yours, and I want yours. Mine is the worst. The thing about OCD is it attacks your values and what you care about most, because the thoughts wouldn't get so stuck if they weren't so distress producing, if we weren't so scared of them. And something I talk about in ACT all the time is that we hurt most where we care, because if we didn't care, why would we be hurting? So when OCD shows up and attacks your values, for each person, it's attacking what they care about most. So it feels the worst to them.
I only just learned about morality OCD like within the last couple months, and I'm so glad that there's a label for that because I kind of thought it was just an ego issue, and I think maybe this is justified or correct, but like I get so mad. Here's an example. I was about to walk through, there's this door with a window in my apartment building, and it was myself and another woman. And on the other side of the window was a large man coming through. And I'm like thinking he's going to open the door and hold it for us because duh. And
That's
he was going to open it and he was going to walk through. So I noticed that and didn't let him and just walked through myself and was like, thank you. Is that morality OCD?
That's what I like to call the justice complex. So with with morality OCD, it's really all about you. It's your morality. It doesn't so much apply to everybody else. It's that you have to do the right thing all the time. The what you're describing there is the term I have coined for it. It's not a therapeutic term, which is the justice complex, which I also have. Hi, nice to meet you. Which is just that there is a right and a wrong way to go about in this world. And if you're going about the wrong way, I'm going to kind of stick it to you a little bit.
Okay, good. I'm in good company then because I have that too. I do it with elevators too. If someone's like
Yes.
trying to get in the elevator while I'm trying to get off the elevator, I'm like, what are you
Yes.
doing? This is not how elevators work.
No, and you can't face backwards. There's common social codes that we all need to abide by. Put your turn signal on. Do the common, decent, non-selfish thing, and just go about that way in the world.
Okay, so maybe my getting mad at other people is not technically morality OCD. It's what you're referring to as the justice complex. That's so funny.
Yeah. There's a right and a wrong way to be in this world. I'll help you
Love
figure it
that.
out.
So what, Allie, what led you to want to write a book?
So there's not a lot of ACT workbooks out there, and I was just so deep in this ACT stuff, and I'm just so passionate about it. It's the feedback I get from my clients and my groups all the time is I'm really excited about ACT. It helped me so much when I learned it and applied it to my own life that I just love sharing it with others. So my hope was, since I was able to just kind of learn these skills and apply them, and it really changed how I go about my life, I just wanted to share this with other people. So I started working on this workbook last year. It took me about 6 months to put together. There were moments where, my motivation dipped and I would kind of walk away from it and then come back. But I just really wanted to make it more accessible for people to do this kind of work with themselves, because while I do think everyone should be in therapy, I also know it's not accessible to everybody, that it is expensive. It is an endeavor to take. There's a lot of people that are working too much and have kids and all these other responsibilities, that how are they supposed to add therapy into the mix? So my hope with this workbook is just to be able to reach more people so that these tools are accessible to everybody.
What's an example of something someone would find in it?
So all the 6 core processes are in it. What I do is I break it down it's a week by week for a 6-week curriculum, which I also offer as well. My first class is going to start in September, and it's going to be more of like an in-depth Zoom course that will dive into the book. But it's broken down week by week, and each one goes into one of the 6 core processes and gives an explanation of it, as well as worksheets that they can use to really implement the skills. I have clients, actually, I was with a client this morning and we were joking around because she knows all the material and she has a really hard time actually implementing it into her life. So the worksheets are really designed so that it's being used and applied, because that's the only way it's going to be helpful, is if you get practice with all of these skills. And then the last chapter also gets into the ACT matrix, which is it's basically like a graph, but it's really organized journaling is how I like to talk about it. Because what it does is it gives you an opportunity to explore your thoughts and feelings and sensations, but then also orient you towards your behaviors. How do you respond to those thoughts and feelings that you don't want to have? What are they leading you to do? And then pivot you further towards your values and what matters to you, and then what actions are in line with that, so that you can really kind of engage this behavior correction.
What was the process like of writing a book?
Um, Honestly, I'm very like meticulous on the computer. I love like data entry type things from my assistant days. So the worksheet process creation was like really fun for me. I really enjoyed like creating the columns and putting it together and coming up with the examples. Where I struggled was more with the narrational, which my next book is going to be fully narrational. So that's going to be a little bit more of a challenge for me. But it was just really fun because it was a chance for me to just further reflect on these skills and how to make them applicable and accessible to everyone, rather than just gearing it towards my specific clients or towards myself.
What kind of people would it be helpful for? Like, what conditions would they be able to find workable solutions for in this book?
I think it honestly can work for anybody who's having a challenging time, whether you're going through grief and loss, maybe there's not even a diagnosis, maybe you've hit a bump in the road, maybe you're going through a breakup and you're trying to like find yourself again. If you've never done values work, I think this book would be great for you because it's so helpful to orient yourself towards the person that you want to be. It makes all of your actions so much more clear. And then from a diagnostic standpoint, I think it could help individuals with anxiety, OCD, depression, trauma, really anything. If you feel you're not living the life you really want to be living, this book can help you get there.
And you said it's 6 weeks. Can it be done before that? Will it take longer than that? What's the process if it's just me and I'm not working with the therapist and I buy this book and open it to page one? What does my journey look like?
You could do it in less time. You could do it in more time. The structure is just kind of to provide some structure for people to keep them on track. Because I imagine there's lots of books we buy, we crack open, and we don't finish. So this is just to provide loose structure. You could do it more quickly. You could do it slower. I don't think you could do it in like a week. Because the fact of the matter is unless you get practice implementing these skills, they're not going to be very helpful. One of my coworkers always says, you don't go out to fight a bear when you've never even fought a bunny. I don't know why he's fighting either of these animals, but I love that metaphor because it's really helpful at articulating, if you just wait until you're at a level 10 of distress, whipping out your tools, they're not going to be very effective because you're overstimulated and you've never used them before. So the more that you can implement this into your day-to-day life, into little stressors, it's going to make handling the bigger stuff so much easier. I mean, every day I'm practicing present moment awareness. Every day I'm trying to, when I notice myself future tripping or past tripping, coming back to the present moment, grounding myself in the here and now, which is training my brain to be able to do that more easily and more often. The more I diffuse, the less my thoughts control my behavior, so that when something big does happen, I can just separate myself from it. It's really, it's helpful all the time.
I love that. I'm gonna ask like one example. So let's say, because I really like this of, let's say it's not diagnosed.
Yes.
I'm going through a breakup. I decide to pick up your book on the shelf. And what's like a principle that I find in it, or what's an exercise that helps me with the ruminating thought of, oh no, he was the one and now he's gone.
So with that thought, first of all, acceptance that you're having that thought. All of us going through breakups are going to question ourselves and our self-worth and question what we brought to the world, to the relationship. So first and foremost, practicing acceptance. And then my next question is, how does that thought lead you to act? What does it lead you to do when you have that thought? Do you go and eat a pint of ice cream? Do you go curl up in bed and just hide under the covers? And is that what you want to be doing? Let's go through values exploration, because where there's pain, there's purpose. So the fact that you're even having that thought tells me that you care about connection, you care about being a good person, a good partner. And then what does that further mean? What is your definition of a good person? What's your definition of a good partner? And what does that person do? And now let's go do it.
Oh, I love that. Do you have any teachers that you look to, whether they're in the medical field or the spiritual world? Like, who are people you look up to?
Oh, that's a good question. I mean, from a personal standpoint, my boss, Chris Mulligan, who's an LCSW, who heads up our anxiety and OCD clinic, I really look up to him. He's the one who taught me everything I know. He's such a good clinician and such a good teacher. I wouldn't know any of this without him. And then outside of my own personal connections, Russ Harris, who was one of the founders of ACT, he has a lot of great content online. The general attitude with ACT is kind of this open source mentality. So there's all kinds of stuff that you can find online with him. But there's so many great authors on ACT. There's the couple founders, Russ Harris and a couple other names that are escaping me at this moment, are just so foundational to creating this whole program and this whole way of going about therapy. And then on a side note, not necessarily ACT related, but recently our gal pal Jamie, she recommended that book, Becoming Supernatural by Dr. Joe Dispenza.
Love that book.
Love that book. She's gotten me into the woo-woo manifestation stuff. I'm all in on it now.
Me too.
Because it's just, within ACT, there's all this, and Jamie and I have talked about this, like, how do we merge this idea of being positive and positive thinking with acceptance of our internal experience? And what is it like to accept and acknowledge what shows up, allow it to flow through us, because in theory, feelings last about 90 seconds if you don't push them away or fight against them. So really acknowledging that, and then pivoting to this observing self, this perspective of gratitude and appreciation and awe of the world, and really then raising your frequencies. So it's just really interesting to explore his book and his ideas and kind of merge it with ACT. And I try to incorporate it into my therapy with my clients as well.
I love that. Ali Stepka, thank you so much for joining us. What do you have coming up? How can people find you and your work?
What do I have coming up? Well, this is Act Your Way to the Life You Love is my workbook, which I have right here.
Gorgeous.
I will have other books on the horizon that are going to be more narrational and more novel-like, but still incorporating ACT concepts. The first is going to be Act Your Way to the Relationship You Love, and then Act Your Way to Being the Parent You Love, to further apply these concepts to these aspects of our lives. And then if anyone is interested, I also created a YouTube channel that has therapy snapshots to make some of these concepts more quick and accessible and digestible. There's also mindfulness activities on there to help engage the present moment awareness. And then also check out my Instagram at Act Your Way to the Life You Love, and also my website, which is actyourwaytothelifeyoulove.com.
Thank you so much for joining me today. And I'll put all this stuff in the bio so everybody can find it. And yeah, thank you. That was so useful and helpful. And I hope everybody enjoys it as much as I did.
Thank you, Galina. Talking to you has been great. You're so mindful.
Thank you.